series
Hello, and welcome to Spurbs Herbs, episode 113. We're going to be talking about a very interesting herb, and so let's get into it. Today, we'll explore another quite important Chinese herb, Huang, Scutellariae Radix, or Baical Skullcap root. This herb is in the Chinese medical subcategory of herbs that clear heat and dry dampness under the category of herbs that clear heat. As one of the, quote, 3 yellows, it is commonly used and useful herb for clearing heat and draining damp in the upper burner, as well as many uses in pregnancy, including calming the fetus. And as usual, we're exploring something a little different. We're going to be discussing butt breathing. What? Please join us for the scintillating episode. Before we get into that, I just want to say we're winding down this amazing special for our courses. I want you to get in there the last chance. If you use them for continuing education, professional development, or just for your own edification, we're offering 50 hours of courses for an unbelievable price. Normally, this would cost $750. However, with the special code 50 CEUs, that's 50 CEUS, it's going to be only $325, so way less than half off. Plus, you get a free signed copy of one of my books, just pay for shipping and handling. There's a free copy of Integrative Pharmacology, combining modern pharmacology with integrative medicine, or playing the game, a step-by-step approach to accepting insurance as an acupuncturist. Just go to the webpage, www.integrativemedicinecouncil, that's COUNCIL.org/CEUS1. So that's integrativemedicinecouncil.org/CEUS1 for this amazing deal. But hurry, it's going to end soon. Okay, of course, when I saw the title of this article, I had to read it. This is the title. Butt breathing might soon be a real medical treatment. I'll let that sink in. Butt breathing might soon be a real medical treatment. And after reading it, I am still saying this is some weird stuff. But some of the coolest medicine is pretty weird. So here we are, about to talk about this interesting study about the possibility of being able to breathe through our backsides. Please stay tuned. It is even more interesting, practical, and useful than you might think. It all started, like many things these days, with COVID-19. During the pandemic, lots of people were put on ventilators to help them breathe. Ventilators are dangerous and can damage the lungs, especially if they're already partially damaged. And in many parts of the world, ventilators are not readily available. The Cincinnati Children's Hospital Medical Center team wondered if there were alternatives, and they took their inspiration from the humble loach, a freshwater bottom-dwelling fish found throughout Eurasia and northern Africa. The loach, along with sea cucumbers, employs intestinal breathing, i.e. through the anus, rather than gills, to survive under hypoxic or low oxygen conditions, thanks to having lots of capillary vessels in its intestine. The technical term is enteral ventilation via anus, or EVA. The fact that there is an animal that can do this is fascinating in and of itself, but the team took it a step further and wondered if this could happen in mammals and possibly humans. Another researcher at Cincinnati Children's Hospital, Leland Clark, had created a possible form of artificial blood, a perfluorocarbon liquid called oxycyte. The team decided to see if oxycyte could be used to allow oxygen absorption from the anus. They tried 2 approaches. They administered oxygen gas or a liquid oxygenated perfluorocarbon intraanally to rodents and pigs. They then induced respiratory failure and evaluated whether either of these methods were effective. They found, surprisingly, both methods were able to prevent respiratory failure without major complications. Think about this for a minute. These animals who have lungs were able to absorb oxygen from the large intestine and prevent problems from lack of respiratory oxygen. Well, this may seem super weird on the surface, and it is, Both the lungs and the large intestine have massive amounts of capillaries designed to exchange molecules with the blood. So now the question is, can this help humans? And I love what Christine just said. Lung and large intestine are connected in Chinese medicine. So there is that connection. Interesting. Which I always thought was one of the weakest of the yin-yang connections, organ connections. But there you go. Okay. So the question was, can this help humans? And the answer is maybe. We're not sure yet. The first human experiment has occurred. They dosed 27 men with non-oxygenated, so no oxygen, perfluorodecaline via the anus, and asked them to retain it for an hour as the dose was increased from 25 to 1,500 milliliters. So for those of us who are not into milliliters, 25 is about an ounce, all the way up to about a quart and a half, a little bit more than a quart and a half. 20 men out of the 27, that doesn't seem like a lot to me. 20 men completed the experiment, and except for temporary bloating and abdominal discomfort, had no other adverse effects. This was an initial test for the safety of the procedure. Next, they will look at the effectiveness of the procedure and whether or not oxygen can be absorbed. This all just happened, by the way, in the last year, so they're still working on it. This is some interesting stuff and can maybe one day save lives and prevent damage to the lungs. Stay tuned for more on this. If I hear anything else on this, you know I'm going to talk about it here at Superbs Herbs. This is just the most interesting thing. I've read some very interesting medical things. This is really interesting to me. I don't know why. Maybe it's my period, I'm a male and I have some weird thoughts. But anyways, there you go. Interesting stuff. Okay, so that's butt breathing. Let's move on to something a little bit closer, the three yellows. With that as a little amuse-bouche, let's talk about today's herb. We have discussed the three yellows before, but it's been a few years, so we're going to discuss it again. Our herb of today, huáng, is one of three herbs known as the three yellows or san huang. Besides huáng, Scutellariae Radix, these three include huang lian, coptis rhizoma, and huang bai, philodendron cortex. All three herbs are in the clear, damp, heat category of herbs and are bitter and cold. They're often used together both internally and externally to treat heat toxins with dampness. While there is a Chinese herbal formula of just these three herbs, the more commonly used formula, coptis decoction to resolve toxicity or huang lian jade tang, adds the cool heat herb Gardenia fructus or jerdza. This formula is the, quote, standard formula to clear heat and resolve toxicity. These three herbs work so well together because huáng addresses issues in the upper burner, especially the lungs. Huang lian addresses the middle burner, and huang bai addresses the lower burner in kidney and bladder. Together, they are very effective for draining damp heat from all three burners, which basically means the whole body. They're also quite antimicrobial and have been found effective in bacterial, viral, and parasite infections. Sometimes a fourth yellow is added, da huang, translated as big yellow, radix et rhizoma. This is a purgative herb that is also bitter and cold and has similar functions as the three yellows, and more functions as well. Purgative herbs are herbs that cause you to pass stool. According to Dr. Sam Liang, the combination of huáng, huang lian, rhizoma coptis, and da huang, radix et rhizoma, ray, such as found in san huang tang, three yellows decoction to sedate the epigastrium, used as a gargle, is very effective to treat sore throat and stomatitis, that's inflammation of the mouth, in HIV patients. And this is according to Chen. With this as background, let's talk about today's herb. Today's herb is huáng or Baical Skullcap root, also known as Chinese skullcap root. And the family is Labiatae or Lamiaceae. We'll talk about why it's an orange just in a minute. Standard species is Scutellaria baicalensis georgii. Georgii, of course, is the biologist who categorized it. Chen also include the following species: Scutellariae amoena, ch right, which they say is Xinan Huangqin; Scutellariae redurana, deals, which is Gansu Huangqin; and Scutellariae viciscidula bge, or Nian Mao Huangqin. The medicinal part is the root. And in English, this translates as yellow or golden herb. Huang means yellow, qin means gold. So yellow golden herb. Other names, as mentioned, Chinese skullcap, Scutellaria scoot, Huangqin cha, Laogun zi qin, Tiaoqin, Beiqin, Bianqin, Kuqin, Lanqin sao, Shan cha gun, Fu chang, or putrid intestine, in Japanese ogan, and in Korean hwangyum. There you go. All the different names. So let's talk about that Lamiaceae family. The Lamiaceae family, including flowering plants commonly known as the mint, dead nettle, or sage family. Generally, Lamiaceae is considered the more correct name, though Labiatae is a correct alternative. So the book said Labiatae, but the book is a little bit older. I mean, the book that I got this from is from 2004, so over 20 years old. And these things are changing all the time. So now the more correct name is Lamiaceae, but Labiatae is still correct, considered correct. These include many aromatic culinary and medicinal herbs, including basil, mint, rosemary, sage, savory, marjoram, oregano, hyssop, thyme, lavender, salvia, catnip, oriental motherwort, lemon balm, and perilla. There are approximately 236 genera and up to 7,500 species, and the flowers are usually bisexual. I have a question on page 718 of the material back. No, I actually have a page 131 here, Christine, so you can look up there if you want to. Bensky, so remember we have 3 major textbooks that we look at, and lots of other textbooks as well, and we look at herbs. So one of those is Bensky and his team, and they say the dose is 3 to 9 grams. The other book is Chen and they say 3 to 10 grams with a maximum dose of 30 grams. And our third book is Brand and Wiseman, also say the dose is 3 to 10 grams. The category, according to Bensky, is herbs that clear heat and drive dampness under the category of herbs that clear heat. Chen say it is in the heat clearing and dampness drying herbs subcategory under the heat clearing herbs category. And Brand and Wiseman say it is the heat clearing, dampness drying medicinal under the heat clearing medicinals category. So basically all say the same thing and put it in the same thing. They just have slightly different translations of the categories. Both Bensky and his team, and Chen and Brand and Wiseman, all agree this herb is bitter and cold and enters the lung, stomach, gallbladder, and large intestine. Though Chen switches the order to stomach and gallbladder rather than gallbladder, because it switches the order of stomach and gallbladder. I don't know if that means anything necessarily, but I thought I'd put it in there. And this level of agreement between all 3 textbooks is unusual. We see this sometimes in the older herbs, and this is an older herb. We're going to talk about that in just a minute. But it's usually there's a little bit of difference between these textbooks. And here's the history, so we'll see why it's an older. Both Bensky and Chen say the original source for this herb is the Shennan Ben Sao Jing, or the Divine Husband's Classic of Materia Medica, written in the 2nd century CE. We talk about this book a lot because it is the first book written on individual herbs, and if that is existing. There may have been other books, but we don't have them at this point. This is existing, and it covers a lot of herbs, about 100 herbs at least, maybe more like 200. And so if an herb is in this book, it is amongst the oldest herbs known to Chinese medicine. So that may be why there's no discrepancy between the 3 textbooks. So let's talk about this category of herbs that clear heat. So according to Bensky and his team, heat in traditional Chinese medicine refers not only to febrile disorders or problems attributable to the invasion of pathogenic heat, but also to any condition that presents with heat signs: dry throat, red face, red eyes, dry stools, dark and scanty urine, yellow tongue coating, rapid pulse, and sensation of warmth in the 5 centers, quote unquote, 5 centers. These 5 centers are the soles of the feet, palms of the hand, and the sternum. Heat can be found in either the exterior or the interior. Exterior heat presents with fever, chills, headache, thirst, moderate sweating, and a floating rapid pulse. Interior heat presents with fever without chills, dry mouth, thirst, irritability, scanty and dark urine, yellow tongue coating, constipation or diarrhea, and abdominal distension. The herbs described in this category are used for treating interior heat. In general, these herbs are cold in nature. So that's the overall category that this herb is in. The more specific is the subcategory, and that's herbs that clear heat and dry dampness. And Bensky discusses this subcategory. The herbs in this section are primarily used for patterns of damp heat, such as dysenteric disorders, urinary difficulty or pain, jaundice, furuncles, and eczema. Most of these herbs have bitter and cold properties, which act to clear heat and drain dampness. Clinically, the herbs in this section are often combined in prescriptions with those that drain fire or clear heat and resolve toxicity. Because of their cold nature, they should not be used in cases of spleen or stomach deficiency, especially not long term. So good quality. According to Bensky and his team, good quality consists of big, golden, yellow, full roots with few, if any, withered areas in the center. Roots with a withered, hollow center or pieces that are broken up are of inferior quality. Bluish-green roots reflect improper processing, which can result in a low content of glycosides. We're going to find out glycosides are an important constituent. Best quality is wild-crafted Scoot King or Qin Huang from Chengde in Hebei province, followed by Ziqin Tiao from Shandong. Chinese medicinal identification and illustrated approach says Huangqin in general should be conical, curved, externally brownish yellow or deep yellow with a slightly bitter taste and a faint odor. And superior grade roots are large, firm, and yellow. Chinese medical actions. According to Bensky and his team, Huangqin clears heat and dries dampness, a major herb for damp heat in the stomach or intestines, which manifests as diarrhea or dysenteric disorder, damp warmth, which presents with fever, stifling sensation in the chest, and thirst, but with an inability to drink, or for damp heat, lower burn with painful urinary dribbling, an auxiliary herb for damp heat jaundice. So that's all one function, clears heat and dries dampness. Next function is clears heat and resolves toxicity, especially in the upper burner, for heat patterns with high fever, irritability, thirst, cough, and expectoration of thick yellow sputum, or hot sores and swelling. For the swellings, for the latter, it can be applied topically or taken internally. That's its second function. Its third one is clears heat and stops bleeding, for internal heat from excess causing the blood to move chaotically. Symptoms include vomiting or coughing of blood, nosebleed, and blood in the stool. So question, what is meant by hot sores? So remember in Chinese medicine, we have hot sores and we have cold sores. So hot sores tend to be red and raised. Cold sores tend to be white and may actually be sunken. So it's just a difference of the type of sores that we're talking about here. So this is going to be good because it's cooling. It's going to be very good for hot sores rather than the cold sores. It might actually make the cold sores worse. So that's what we mean by hot sores. Okay. So third function was clear heat and stop bleeding. Our yes, so something like a boil or inflamed acne. Yes, if it's red, it has to be red. Exactly. Okay, our third function, clears heat and calms the fetus. Pacifies the womb when the fetus is restless or kicking excessively due to heat. And the final function is sedates ascendant liver yang for such symptoms as headache, irritability, red eyes, flushed face, and bitter taste. in the mouth. Brandon Wiseman say clears heat and dries dampness, drains fire and resolves toxins, cools the blood and staunches bleeding, and eliminates heat to quiet the fetus. So very similar to what Bensky says. The Shenong Bensao Jing, or Divine Husband's Classic of the Materia Medica. Remember, this book is the first book, and it tends to often has different functions than the modern functions, and sometimes put in some more esoteric aspects like magic and spirits and things like that. I don't think it does here, but so that book says this is a middle class herb. This book classifies herbs as superior, middle, or inferior class herbs. Middle class herbs mean that they're safe but should only be used in cases of conditions, while superior class herbs can be used all the time to help health, and inferior should only be used if necessary. So this is a middle class herb. It is bitter and balanced. It mainly treats various kinds of heat, jaundice, intestinal afflux, diarrhea, and dysentery. It expels water, precipitates, i.e. freeze, blood block, and treats malign sores, flat abscesses, erosion of flesh, and burns. The Shenong Bensao Jing has a footnote discussing the interface between this text and modern uses of Huang. Quote, Scutellariae clears heart fire, drains lung fire, and treats upper burner heat, skin heat, and all other kinds of heat in both the interior and exterior. This is why the text says it mainly treats various or all types of heat, jaundice, intestinal afflux, and diarrhea. It also disinhibits the qi in the chest and disperses the phlegm above the diaphragm. When there is lung heat cough with copious phlegm and foul smell in the throat, it is the right medicinal to choose. Glomus fullness below the heart is due to heat. Therefore, Scutellariae is also prescribed for it. Besides, it is an important medicinal for women's diseases. Postpartum, it may nourish yin and abate yang, while during gestation, it may quiet the fetus. Loss of blood due to heat or postmenopausal recommencement of menstruation caused by blood heat also requires Scutellariae. Finally, it may also be used as a remedy for dry bound stools, sore toxins, and other miscellaneous illnesses due to heat. So that's the Shenong Bensao Jing. Nice treatise on that. Doesn't usually have that much in more of the modern phase. Zhao and Chen, that's the Chinese medical identification book, say it clears heat, dries dampness, drains fire, resolves toxins, stops bleeding, and calms the fetus. These are all they all are pretty much in agreement. Finally, we have Chen, who say this herb clears heat and dries dampness. Huang Radix Scutellariae treats a wide range of heat-related disorders characterized by fever, abdominal fullness, poor appetite, nausea, sensations of heaviness, thirst with no desire to drink, a red tongue with greasy yellow coating, and rapid, slippery pulse. It clears heat and sedates fire. It clears heat and eliminates toxins. Huang is commonly used for disorders of the skin, eyes, throat, ears, and nose. It cools blood and stops bleeding. It calms and stabilizes the fetus. Huang stabilizes pregnancy, calming the fetus to relieve restlessness and constant kicking, a condition commonly described as heat in the womb. Preparations. Bensky and his team discussed 6 types in preparations for this herb. Bland Scutellariae are Dan Huang. This is another name for unprocessed Scutellariae. It is usually washed, soaked in cold water, and sliced when softened. This is the form that will be dispensed if no special instructions are given. Young Scutellariae roots are Zi Huang. This herb is solid in form, green on the inside and yellowish on the outside, with thin, soft rootlets. It's also known as twig Scutellariae, Tia Huang, or soft Scutellariae, Nen Huang. Young Scutellariae is considered to be the best quality. Because of its solidity, was traditionally thought to be heavier and more sinking in nature than the other forms. It enters the arm-yang brightness channel and therefore tends to drain the large intestine and lower burner of fire. Dried Scutellariae roots are huáng. This herb is hollow in form, black on the inside and brownish yellow on the outside, with hard rootlets that resemble rotten wood. This is also called sliced Scutellaria or pian huáng. Traditionally, due to its empty center and consequent lightness, dried Scutellaria was thought to ascend and enter the arm greater yin channel. It therefore tends to clear and drain lung fire and release externally contracted heat. Dry fried Scutellaria or chao huáng. Here the herb is dry fried over a moderate flame until the surface is slightly charred. This has the effect of guiding its actions to the blood level. It is especially appropriate for lower burner heat or for disturbed fetal qi during pregnancy. This method of preparation also moderates the herb's cold nature, thereby moderating the ill effects of excessive bitterness and cold on the stomach and spleen. Wine-fried Scutellaria jiu chao huáng. This is also called wine Scutellaria jiu qing. The herb is soaked in yellow rice wine and briefly dry fried or baked with moderate heat, then dried in the open air. The wine helps the herb's actions ascend and strengthens its ability to clear and eliminate damp heat from the upper burner. For example, Zhu Danqi, who's a very famous doctor, recommended combining wine-fried Scutellaria with Angelica dehurica radix or Baical as a powder to be taken with green tea for pain in the eyebrow and eye socket associated with wind heat and phlegm. Finally, we have charred Scutellariae huáng tan or scorched Scutellariae jiao huáng. The herb is dry fried over a high flame until the surface is thoroughly scorched brown with black edges while still retaining its original shape. The scorched Scutellaria is still able to cool heat, but can now also stop bleeding. It is therefore appropriate whenever heat in the blood causes the blood to move chaotically and hemorrhage. Chen and Chen says, use the fresh form to clear damp heat in the intestines, the dried unprocessed form to clear heat and remove toxins, the dry fried form to calm the fetus, the steamed with grain-based liquor form to clear lung heat, and the charred form to stop bleeding. So that is much more succinct, not as detailed, but much more succinct than what Bensky and his team said. So very similar uses though. Western uses of this herb. The PDR for Herbal Medicines does not have an entry on this herb. It does have an entry on WebMD, which primarily supports its use within the Chinese medical system. An entry from Memorial Sloan Kettering Cancer Center also primarily references its Chinese medical functions. In other words, given its patterns of uses and cultivation, it really is only cultivated, only grows in Asia. This appears to be a primarily Chinese medical herb, so it's not really used in Western herbal traditions that I can find. Bensky and his team has, as usual, a great commentary about this herb. Bitterness dries dampness, and coldness clears heat. These are the two attributes of Scutellariae Radix huáng, whose actions focus primarily on the lungs and somewhat less directly on the large intestine. However, if matched properly with other herbs, it can clear fire, heat, or damp heat from the spleen, liver, gallbladder, and small intestine channels. Scutellariae Radix huáng is often used in the treatment of persistent irritability with fever and febrile disorders, damp heat focal distension, jaundice, diarrhea, and dysenteric disorders due to damp heat. It is a noted fetal quieting herb benefiting both the mother and the fetus when heat disturbs the pregnancy. For this purpose, it is best used dry fried or baked so that its bitterness and coldness are moderated. It is often used for bleeding from internal heat, nosebleed, sores, and swellings, and red, swollen, sore eyes. Rectification of the Media Materia Medica, the Bensao Zheng, written in 1624, observes, Scutellariae Radix huáng is a very bitter and very cold herb which generally treats all damp heat. Its nature is quite similar to Coptis rhizoma huáng. Thus, in its main sphere of therapeutics, it is often combined to act together with Coptis rhizoma huáng. Furthermore, while its bitter flavor is directed straight downward, its aroma is light and clearing. Thus, it penetrates both above and below, reaching all the organs internally, while externally reaching the muscles, flesh, and skin. Chen and Chen says organs injured by fire can be treated with optimum results by key herbs, including Huang, Radix, Scutellariae, and Sang Bai P, Cortex Mori, for lung fire. They also say there are 4 herbs commonly used to stabilize pregnancy. Huang calms restless fetus caused by heat. Sha Ren, or Fructus amome, that's cardamom, or one of the cardamoms, regulates qi and calms restless fetus in the presence of qi stagnation and middle jiao deficiency. Du Zhong, or Cortex euchomia, is most suitable to treat restless fetus caused by deficiency of the kidney and liver. And Baizhu, Rhizoma atractilotus macrocephalae, keep this in mind, treats restless fetus from spleen qi deficiency. Comparisons. Bensky and his team compares this herb to gypsum fibrosum or shurgao, which is a very cooling herb in Chinese medicine. Both of these medicinals cool lung heat and drain fire from excess at the qi level. Scutellariae Radix Huang is bitter and cold and focuses on clearing heat and drying dampness, but it also cools the blood to stop bleeding and quiets the fetus when heat disturbs pregnancy. By contrast, gypsum fibrosum shurgao is acrid, sweet, and very cold. It focuses on cooling, releasing, and venting heat in the muscle layer. Its strongest suit is its ability to eliminate heat so that fluids can regenerate. Its sphere of influence is primarily qi level heat from excess and drying heat in the lungs and stomach. So that was comparisons, the only comparison. Combinations, Bensky and his team discussed 4 combinations of this herb with others. And we've already talked about one. The first one here is with Coptis rhizoma or Huang Lian. Just mentioning that. Both are bitter, cold herbs that clear heat, dry dampness, drain fire, and resolve toxicity. Traditionally, Coptis rhizoma Huang Lian acts primarily to drain fire from the heart and stomach, while Huang clears heat from the lungs and stomach. The combination is thus best suited for draining pathogenic heat from the upper and middle burners, especially when it has accumulated to the extent that it causes high fever, redness, swelling, and pain of the face and head, dry mouth, parched throat, ulceration of the mouth and tongue, nosebleed, and rashes. Both herbs also enter the large intestine channel, particularly young Scutellariae Radix or Zi Huang. This combination is therefore often used for damp heat that is accumulated in the intestines, leading to explosive diarrhea with a sensation of burning in the rectum or fetid, filthy stools and abdominal pain. In addition, Huang cools the blood in order to quiet the fetus in pregnancy, while Coptis rhizoma Huang Lian clears heat to alleviate nausea. The combination is therefore useful in pregnancy when nausea occurs with heat disturbing the fetus. However, due to their bitter cold properties, the combination should be used in small doses for only a short period of time and should be discontinued when the desired effect is achieved. Preparation with wine guides the action of these herbs into the upper body, enhancing their ability to clear upper burner heat and fire. Thus, when the prepared herbs are combined, they treat red, swollen, and painful eyes, ulcers of the mouth and tongue, or constrained heat in the blood level, leading to irritable restlessness, bleeding, and sores. So that was our first combination. Our second one is with Gardenia fructus Zhizi, which again we also mentioned when we talked about the 3 yellows. Gardenia fructus Zhizi clears fire and constrained heat from the triple burner, expels dampness, breaks up toxic accumulation, and directs fire downward. Huang is bitter, cold, and enters the qi level to clear heat and drain fire, acting particularly on the upper and middle burners. Together, they powerfully clear and drain lurking heat from the lungs associated with such symptoms as fever, sensation of fullness in the chest, cough with yellow sputum, and nosebleed or spitting up blood.
The pear is likewise effective for damp heat and jaundice, sores due to heat toxin, and irregular gynecological bleeding due to constrained liver channel fire. Charred Gardenia fructis sterza is better for entering the blood level to expel constrained heat and thus stop bleeding, while Huang, when fried in wine, is better for draining lung fire and upper burner damp heat. Our third combination with Atractylotus macrocephalae rhizoma, or Baijiu. This is a well-known fetal quieting combination advocated by Zhu Danxi. Huang is bitter, cold, and clears fetal heat to prevent bleeding from excessive heat in the blood. Atractylotus macrocephalae rhizoma Baijiu is bitter and warm, which enables it to dry dampness, but it is also sweet, which tonifies the middle burner and thereby enables the spleen chi to control the blood. This pair of herbs thus pursues two avenues for stopping bleeding in early pregnancy, reducing the heat to quiet the blood and strengthening the spleen's ability to keep the blood within the vessels. And our fourth combination is with Paeonia radix alba, or Baical, that's white peony. This combination was first cited in a formula from Discussion of Cold Damage. So we talked about the first book on existing on individual herbs. The Discussion of Cold Damage is part of the first book found that we have on formulas. So this is one of the first books on formulas. So the combination was first cited in a formula from Discussion of Cold Damage, Scutellariae decoction Huang Qing Tang, to treat dysenteric disorders with abdominal pain due to heat entering the interior. Huang is bitter and cold and drains heat in the large intestine, while Paeonia radix alba, or Baical, is bitter, sour, and cool, moderates urgency, stops pain, and augments the yin blood. Together, the bitterness drains while the sourness restrains, thus eliminating pathogenic heat while it restrains and moderates excessively urgent intestinal movement. Generations of physicians have used this combination as the foundation upon which to design prescriptions for painful dysenteric disorders due to heat. It is also, however, a common gynecological combination used for cooling heat while nourishing the blood, particularly during pregnancy, as Huang is noted for quieting the fetus when it is disturbed by pathogenic heat. Paeonia radix alba Baical cools and nourishes the liver blood in yin, while Huang cools heat in the blood aspect. Thus, this combination is used together with other herbs for disorders such as liver heat accosting the spleen and stomach in early pregnancy, leading to severe nausea and vomiting. Those are our four combinations in Bensky's. Contents of Huang Qin. According to Bensky and his team, the contents of this herb include flavonoids such as bicalene, wagonin, norwagonin, chrysin, and oroxylin A, glycosides such as baicalin, dihydrobaicalin, scutellarian, and wagonicide, chalcones, and other constituents such as phenyl, ethanol, glycoside, volatile oil, amino acids, campesterol, beta-sitosterol, and stigmasterol. Chen lists many of these and add skullcap flavone 1 and 2. And the pharmacology of Chinese herbs lists many of these and emphasize baicalin, wagonin, and beta-sitosterol, which is a constituent found in many herbs. Let's talk some science. According to Chen, this herb is antibiotic, analgesic, anti-inflammatory, antipyretic, so it helps fevers, cholagogic, which means it helps the gallbladder, hepatoprotector, protects the liver, antihypertensive, lowers blood pressure, mildly sedative, and diuretic, meaning it helps promote urination. They also quote several studies showing positive results in the following cases: infectious and chronic hepatitis with both oral administration and injection, and that had a 268 subjects, so that's fairly decently powered. epidemic encephalitis, so that's infection of the brain, and that had 209 subjects. As a preventative in epidemic scarlet fever, and this had an N of 1,577, so very large, but it's hard to show it as a preventative. So even that number, even though it seems large, I think it's kind of small to kind of determine if it's a preventative in epidemic scarlet fever. But there you go. That's just me sensing. Can be helpful in hypertension. This had an N of 51, so that's relatively low powered. Don't know. Remember, we're always looking between 30 and 40 minimally, just to make sure that we can apply population statistics. So this is just a little bit above that threshold and is relatively small in showing that it helps hypertension. And then it was also shown to help trachoma, which is a chronic bacterial eye infection caused by chlamydia trachomatis. So trachoma using baicaulin. So that's not really the herb; it's a constituent of the herb, and it's considered one of the main constituents of baicaulin. Ophthalmic solution. So in other words, they were putting drops in the eyes, and that had an N of 128. So again, not minimal, but not huge, but not bad. Memorial Sloan Kettering Cancer Center says preclinical data suggests that compounds in S. baicalensis cause apoptosis, that's programmed cell death, in various cancer cells and protect against doxorubicin-induced cardiotoxicity. So doxorubicin is a chemotherapy agent, and it protects the heart when you take doxorubicin. However, both S. baicalensis root and its main flavonoid baicaulin appear to have dose-dependent pro- and anti-angiogenic effects. So angiogenic means it promotes angiogenic means more arteries going to it. So when a cancer develops, it needs a lot of blood flow in order for it to grow. So one of the things a cancer tumor will do is be angiogenic. It will promote arteries to form. And so depending on the dose dependency, this can be pro or anti-angiogenic. We want it to be against cancers, that would mean anti-angiogenic, but it can be pro depending on the dosing of it, according to this paper, this website. Some constituents may also have neuroprotective, anticonvulsant, and anti-inflammatory effects. Studies in humans are quite limited. A preliminary study of S. baicalensis, along with metformin, which is a diabetic drug, appeared to improve glucose tolerance, inflammation, and gut microbiota in patients with type 2 diabetes. An herbal supplement containing S. baicalensis reduced symptoms of osteoarthritis, which is interesting. That was all from Memorial Sloan Kettering Cancer Center. One systematic review and meta-analysis looking at the use of Huang for major depressive disorder concluded these results preliminarily suggest that Scutellariae baicalensis can alleviate depressive behaviors and modulate underlying mechanisms, which is expected to be a promising antidepressant. That to me sounds pretty preliminary, but interesting. Another review summarized Scutellariae baicalensis has shown significant effects on the treatment of various diseases, especially hepatitis, diarrhea, vomiting, and high blood pressure. Numerous traditional uses of Scutellariae baicalensis have been confirmed by current investigations. That one seems a little biased, but we'll let it go. Drug-herb interactions. One small human male study with an N of 24, so that's not over a threshold. So this is too small to apply population studies. However, it's significant. It's human clinical studies, which we don't often get with drug-herb interactions. So this is important. Showed induction of cytochrome P452C9 and inhibition of cytochrome P452E1. So it's rare that we get human studies showing this. So that's significant. Another study showed significant inhibition of cytochrome P453A4, both in vivo and in vitro. So this is an interesting one. So cytochrome P453A4 is the one that we're most worried about. 40 to 60% of drugs utilize that for metabolism. So it actually affects a lot of drugs, 3A4 more than any of the other types of cytochrome P450. However, this study was in vivo, which means in life, which means animals, and in vitro, meaning in glass, which means in the lab, not clinical. So until something's clinical, it's not clinical. So this does not necessarily demonstrate that 3A4, there's inhibition of 3A4 from Huang. However, it indicates that it could possibly do that. We need to have human studies. So I'd be concerned that it would have cytochrome P450 3A4 interactions, though there's no proof of that at this point. The American Herbal Products Association's Botanical Safety Handbook puts this herb in interaction class B. They only have 3 classes, A, B, and C, so this is the second class. Herbs for which clinically relevant interactions are biologically plausible. And I think just with these cytochrome P450 interactions, I think some interactions are certainly plausible here. So we do need to be concerned about drug-herb interactions. I don't think we need to be overly concerned, but we do need to be concerned. Talking about concerns, let's talk about some concerns about this herb. How's that for a segue? Bensky and his team say under cautions and contraindications, contraindicated in cases of cold from deficiency of the spleen and stomach. Under toxicity, they say there are some reports of side effects after taking the preparation orally or as an injection. Symptoms include discomfort in the stomach and diarrhea. The following allergic reactions have also been reported: flushing of the skin along with vesicles or macular erythema redness, mainly in the face and on the exposed areas of the limbs. Chen and Chen echo these concerns, saying bitter and cold, Huang should be used with caution as it may damage stomach qi and injure spleen yin. Patients with the following conditions should use Huang with extreme caution: blood deficiency with abdominal pain, edema due to spleen deficiency, loose stool because of kidney deficiency, amenorrhea, that's lack of menses, from blood deficiency, and unstable pregnancy caused by excess cold. Remember, this is very cold, so don't want to use it when there's cold. Brandon Wiseman say, warning, the bitter cold nature of Huang can damage the stomach, so it is not suitable for patients with spleen, stomach, vacuity, cold. And the American Herbal Products Association's Botanical Safety Handbook puts this herb in safety class 1, herbs that can be safely consumed when used appropriately. And I think that's the key about this herb. This is a herb when used inappropriately can be quite damaging to the body, but when used properly, it can be very effective in the body. Summary. We started with a look at something a little different, a look at a fascinating, if exceedingly weird medical possibility, butt breathing. I can't believe it. Then we looked at another single Chinese herb, Huang, Scutellariae Radix, or Baical Skullcap root. This herb is quite important and commonly used Chinese herb to help the upper burner and calm the fetus. While it may have some cautions in drug interactions, when used appropriately, it seems to be a relatively safe herb. And that was another exploration of a very helpful, important, and commonly used herb. In our next episode, we'll be a little different. We're going to explore the whole category of Nourish the Yin Chinese formulas. These formulas are used when the body fluids and essences are damaged, such that yin becomes deficient and yang relatively excessive. We're going to figure out what all that means. This can become more prevalent as we age and can affect women, especially menopausal women, more than men. And as usual, we'll be adding something a little different. It's going to be another elevating discussion of herbs, so please join us in 2 weeks. I'd like to say thank you very much. If you like this podcast, please do us a huge favor. Either subscribe or in your favorite podcast app, or give us a 5-star rating. We appreciate either one of those and appreciate you just even thinking about it. Thank you. And don't forget our amazing continuing education deal at www.integrativeMedicineCouncil.org/CEUS1. You can always get in touch with me at drgreg@spurbsherbs.com or our website, www.spurbsherbs.com. And as usual, we have a good bibliography. Thank you.